So hello, everybody. So we're here with another ADAA public education webinar. So just first, let me present myself. I'm Karen Martinez. I'm a channel medicine psychiatrist at the University of Puerto Rico, and I am part of the ADAA Public Education Committee and also the co-chair of the Women's SIG. Just wanted to highlight before we start our website, www.adaa.org, where we have much more information on topics similar to what we are going to be talking about today, but also about depression, anxiety, and all sorts of important information that you can find. One of the most used resources is the Find a Therapist, where you can find more than 1,000 licensed mental health providers in this directory that specialize in anxiety, depression, OCD, PTSD, and you can look for therapists by geographical location or by disorder. Also, we have a free online anxiety and depression peer-to-peer support group where you can subscribe and find some peer support. And we have an English and a Spanish community where more than 20,000 people have already signed up for these support groups. And finally, if at the end of our presentation you have any questions for the presenter, you can email your questions to webinars@adaa.org, and we will try to get your questions answered as soon as possible. So now let's talk about our presenter. So we're really happy to be having today this webinar by Jenny Dipp, and she is the founder of the Renewed Freedom Center and Littlefinger Center. She's also a clinical assistant professor of psychiatry at the USC Keck School of Medicine at Los Angeles, California, and she's also a public education committee member for ADAA, and she is going to be presenting today on fostering mental wellness for a stressless pregnancy. So let me just make sure that I get Jenny here as a presenter. So we're going to switch up in a minute. So, Jenny.
Hi, thank you so much for having me, Karen. So we're going to talk about pregnancy, and for many of you, both males and females who have gone through this or who is currently going through this, it can be a very stressful period. So what I like to do is talk about first what are some of the stressors that are involved in each period of the stages of pregnancy, and then talk about some coping strategies that you can attempt to use to minimize some of these stressors. So first of all, pregnancy is supposed to be bliss, isn't it? Unfortunately, for many of us, pregnancy can be filled with a lot of anxiety, fears, worries, concerns, and that can interfere with the feelings of bliss that we're supposed to experience. So let's talk about how prevalent anxiety is during pregnancy. It's the highest during during the pregnancy and the postpartum periods. In the pregnancy period, the first and the third trimester tends to be the most anxiety provoking, for good reason, because during the first trimester to make sure that the pregnancy is a healthy pregnancy, and then during the third trimester it occurs with a lot of body aches and pains and anxiety about the future newborn and the process of delivery. And this is true for both men and women, and we're going to talk about some of the differences in the anxiety experience for both men and women during these periods of pregnancy. So anxiety during pregnancy occurs in more than 25% of women and about 20% of their partners. And anxiety can be generalized anxiety, which is about 10.5%, which occurs in about 10.5% of women, and other anxiety disorders such as OCD or social anxiety, which occurs in about 12 to 40% of women. So what are some of the fears and challenges? Well, in the preconception period, I mean, obviously it comes with a lot of the fears of, well, what if you don't, if you're not able to conceive? What if it ends up in a miscarriage? Also, with the cost of fertility treatments going in the 5-6 digit figures, that can be pretty challenging and anxiety provoking. And if you're spending all of that money on fertility treatments, what if it doesn't work? What if you've gone through 4 to 5 fertility treatments already, and each in itself takes up a lot of time and it doesn't work? That's going to create a lot of anxiety and discomfort and worries. Having healthy eggs and sperm is a challenge in itself, especially as you're edging above age 35, which at that point you become a high-risk pregnancy. Then there are all of the hormone medications and injections that is going to change your mood, change your experience. All of the appointments that you have to be able to make, whether this is during the fertility treatment or even during your first, second, or third trimester. And if you're not able to get or stay pregnant, there's that sense of helplessness, hopelessness, anxiety, depression. And then as a result, there's a lot of partner conflict. You're, with the blame and resentment of whose fault it is, and is it his sperm or her eggs? And all of those anxiety provoking thoughts and situations doesn't help you have a healthy pregnancy. So what can we do about that? Well, first, it's important to understand what kind of challenges occur during each of the pregnancy periods. So first, in the prenatal period, some of the challenges that women will say is that there are a lot of risk factors. A high-risk pregnancy is one that threatens the health or life of both the mother or her fetus. And risk factors can include existing health conditions, being overweight and obese, having multiple births, which is very common with fertility treatments, so having twins or triplets or even more. And your age is a huge factor, as I said earlier. If you're under the age of 18 or older than 35, that is a high-risk pregnancy. Many women during this period are really concerned about maintaining pregnancy, and therefore they engage in behaviors such as counting the fetal movements. And this can become a compulsive behavior in order to reduce the fear of losing the pregnancy. Now, the first trimester is really important because that is the period where you determine the health of the fetus, depending on the health of the mother and her environment, of course. So obviously, we know that your support system is really important at this stage. The support system that you have with your partner, the support system that you have with friends and family. However, there's a discrepancy during this period, which is that 12-week privacy theory that a lot of people have. You don't disclose that you're pregnant until you reach the 12-week period, which is when the pregnancy is supposedly safe. However, those first 12 weeks, if you're maintaining privacy and secrecy, that is at the expense of your support system. So it's really important for you to weigh out the risk and the benefits of maintaining that secrecy, so that if you do lose the pregnancy, you don't have to come up with explanations. Um, However, again, you're doing it at the sacrifice of um, your social support system, which I think is one of the biggest contributors to being less stressed during pregnancy.
And
So
Jenny,
obviously, yes.
yes. What about, I think there's so much information out there about what is a healthy pregnancy, what does a healthy pregnancy look like, what you're supposed to be doing. So do you think that could also have an effect on the anxiety that these partners that are dealing with a new pregnancy can go through?
Oh, social media is awful, and the internet is awful. So yes, there's so much out there, whether from your friends or, other people's opinions and the internet about what is a healthy pregnancy. And I think there are pros and cons. Obviously, you want to be aware of the things that you do that can maintain a healthy pregnancy or not. However, then, if you delve too far into all of that information, it can create a lot of anxiety. So you have to find a healthy boundary in terms of what is an appropriate amount of information. Obviously, your OBGYN would be the first person that you would seek information from. And if you have a really good OB, he or she would be providing you with all of this information up front anyway, so that you don't have to go deep into cyberspace to find this information. Um, so we are going to talk a little bit more about that toward the latter part of the webinar. So thank you for bringing that up. Obviously, as you see on this slide, there are tons of warnings of what an unhealthy pregnancy can involve. So some of the stats that include that comes with Down syndrome and chromosomal abnormalities, birth defects, spina bifida, as well as autism.
Yeah, it
So
seems
yes.
about so many things going on that it's a miracle that they're healthy pregnancies.
I as I was going through this PowerPoint, I mean, I wrote this PowerPoint pretty much right after I gave birth to my twins, and as I was going through this to prepare for this webinar today, I was like, oh my goodness, I can't believe I went through all of that. So yes, it is insane how much is involved in having a pregnancy, never mind trying to have a healthy one.
But most pregnancies are healthy. That's, I think, the bottom line. Mm-hmm.
Yes. I think, we tend to focus and over focus on the dangers and the threats of having an unhealthy pregnancy that are going well. We engage in these mental mind traps where we discount all of the positive things and we zoom in on the negative things, and then we magnify and catastrophize all of the negative things. I'm actually going to talk about some of those mind traps in the middle of the presentation. So just quickly to go through some of the other challenges. There's dangers to the fetus, placental eruption, placental previa, preterm birth, stillbirth, which amazingly still occurs today. And then there's the maternal health and wellness. I remember going through all of these tests and, testing for gestational diabetes and preeclampsia. I mean, I never even realized that these things could even occur during pregnancy until I was informed that I needed to take these tests. So obviously, with all of these concerns out there, they are real triggers to feelings of anxiety and stress. during pregnancy, and we have to figure out a way to find that boundary, again, find that balance between how much information is too much information. So during the postpartum period, there are a lot of challenges, obviously, that comes with that. There's the hormonal changes, the quick fluctuation in your estrogen and progesterone levels that can result in postpartum depression or postpartum blues, to OCD, postpartum OCD, and postpartum anxiety. And you know, you're expected to do a lot as a real mother, and nobody cares about whether your body is recovering appropriately. So despite the feelings of bloatedness and swelling and pain and fatigue, you're still expected to care for the newborn and to provide for the newborn, and what I would like to call being a milk factory to milk addicts in those first few weeks of the infant's life. So there are a lot of challenges. And again, just because we are now past the prenatal period, it doesn't mean that there are no more threats to your newborn. I mean, there is so much information and concerns on the internet about SIDS. I remember there, you know, as soon as you register for one baby item, you start getting all of these, you know, emails about this device and that device to prevent SIDS. So those are still real fears that exist in many new parents. And you know, during the postpartum period, there's effects of the sleep deprivation. Sleep deprivation is real. So with sleep deprivation comes changes in your mood and your emotions. It interferes with your ability to communicate more productively and effectively. It definitely interferes with your tolerance and your patience. And if all of that is happening, you also have to realize that this pregnancy doesn't just involve you, it also involves your partner, for most people. And if you're not in agreement in some of the new roles and responsibilities and expectations with your partner, or who the other caregiver is, or who the other caregivers are, then there can be stressors in that as well. And obviously, having a baby means an increase in financial resources that you'll need to have, and that can be an additional stressor. Family involvement can sometimes be helpful or not. There are some families who can be overbearing and give you unnecessary opinions that you really don't really need to hear. And then there are some families who are less interested in the newborn, and that can generate feelings of discomfort as well.
And I think that has a lot of cultural differences too. You know, coming from a
Definitely.
Latino family, you know, like everyone's super over involved and everyone has an opinion on the best way to, you know, how you should be doing, what you should be doing in your pregnancy.
Oh, definitely. I definitely know in my culture, in the Asian culture, I mean, my parents were very involved in my pregnancy, and as soon as I came home with the babies, they immediately told me what I could do, what I couldn't do, for me to be able to heal my body and what's best for the infant. So yes, family involvement can be both helpful and not so helpful. And it's important to be able to find those boundaries as well with your family as well as your extended family. I know that there are some families there are with you have to be able to find a way to inform. We're really not taking visitors at this time, and then you are put bounds, which also means that they're going to have their own fears and challenges. So what are to deliver their samples can be a socially anxiety provoking experience. And, there are many males who will say that they feel like they're in a science lab if they're having to get pregnant from fertility treatments. So there's the perform anxiety around sex. It has to be done in specific times for ovulation. Of course, you have to perform multiple times to increase the chances. And the fears of inadequacy can facilitate that feeling that you're really not human, that you're just a robot. And that can interfere with the chances of getting pregnant in itself, because if the partner is feeling like a robot, and the sperm is only just a route to getting pregnant, then that really takes away that sense of being together, which is really important to facilitate a healthy pregnancy. So some other concerns that could occur, if one partner wants the baby more than the other, a partner, males generally aren't on a timetable as women are, so therefore that can be a difference and a contributor to disagreements between the two partners. And if you're unable to conceive, then there's also that feeling that this will never end, that I'm just having to perform and perform and perform like a robot, and unless she gets pregnant, this is just going to be a never-ending pattern, which doesn't feel good. And I can't say that the male partners really get much sympathy or support from their peers, because this really isn't talked about within the male community. I mean, women do share their concerns and they share their pains and sufferings and all of that. However, because of the stigma that this have and the sense of the alpha male that men have to assume, the sympathy and the support really isn't present, and therefore it adds to the stress of trying to get pregnant. And then some of the challenges during the prenatal period, well, the conception honeymoon is very, very short. As soon as you've conceived, yay, 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 this is great. However, then comes immediately to all of the first trimester testing, and if the woman is feeling a lot of the first trimester physiological ailments, such as morning sickness, or for me it was all-day sickness, that can add to the burden for the male partners. Intimacy obviously decreases as anxiety increases, and then the birth itself, during labor, you have a ton of doctors and nurses in that room, in the delivery room. And sometimes the male partner can feel unimportant which is hard to experience, especially when you're expected, or the male partner is expected to be the protector, the caretaker. And again, as what you were saying, Karen, this is very different in different cultures as well. However, I would say that most males have reported that they feel not important during labor, when everyone else, all the doctors and professionals are involved, and it's all about the woman who's giving birth, and the father's usually being pushed aside to the edge of the room. So that's really the picture that comes to mind when I hear a lot of the men talk about the birthing experience. And then during the postpartum period, the reality is that men still are not prepared to take care of children, and they also lack the social support. With the addition of financial responsibilities and pressures, those are huge stressors for men. Obviously, the attention is now moved from the dyad between the male and the female, or the two partners, to triad, or even more if you're having a multiple birth, because now you have an additional person who is involved in all of your decision-making process. And during the postpartum period, anxiety, OCD, depression, these are real experiences that are underreported, however, and misdiagnosed, that a lot of both male and females experience. So what are some of the concerns that males have? Well, there's a lot of the same concerns that women have, such as fear of dropping, injuring, or harming the child. There's also the reactions that the mothers can have of their partners, that the partner is doing something wrong or not doing something good enough. So when there are already all of these pressures, and then you get the negative reaction from the mother, then it makes it difficult for the male partner to want to be present, because nobody wants to be present in an environment that's not conducive of joy, right? That's not conducive of wellness and health. So if a male feels that he is incompetent because of the reactions of the female partner and his own fears of not being a good caretaker of the child, then that can lead the partner to engage in dissociation type of strategies, such as avoiding having to come home and escaping at work, or even there are thoughts of running away from the situation. And these are all real fears that come with parental burnout, which is something that we don't talk about enough. However, we do need to address.
So it seems, Jenny, that you are talking about all of this that you've been talking from, from the woman who's given birth to their partner, are real fears. It's something that really, like getting pregnant and then being pregnant and giving birth, it's just a very stressful experience.
Definitely. And again, yes, these are all real fears, and these are fears and concerns that exist for most every parent, whether you are, the female partner or the male partner. Again, how much of it is excessive is up to you to determine, right? So again, it's about finding that boundary between how much information is too much information, because if it's too much information, then you're going to be overwhelmed, and being overwhelmed is not what will produce a healthy pregnancy. So we want to be able to find that boundary. And as this diagram illustrates, there's an inverse relationship between stress and fertility. So as as you are more stressed, your ability to become fertile and have a healthy pregnancy actually decreases. So we want to be able to keep that in mind. And therefore, decreasing your stress level, decreasing that amount of information that's coming into you is really, really important. And then there are also physiological effects of stress and anxiety. It raises your blood pressure, your heart rate, raises your cortisol levels that can be transmitted into the placenta. The It causes a multitude of bodily complaints, nausea, vomiting, stomach pain, diarrhea, tingliness. So these are physiological effects that comes from stress and anxiety that can be transmitted to the fetus through the placenta.
And the effects of stress and anxiety can also worsen some of the complications that you can see in pregnancy, like preeclampsia and all that. So
yes, exactly. So, you know, there's so much information now from epigenetics. And what a lot of the research is indicating is that it doesn't really matter what kind of genes you have, because genes can turn on or turn off depending on the stressors that are around you. And if you are experiencing a lot of stress during pregnancy, that can turn on a lot of the more protective defensive genes rather than some of the growth-oriented types of genes. So that is really important to take into consideration, because when that happens, there's a term called colicky infants. Well, colicky infants, are infants who have a very who have a very low tolerance for discomfort, and who tends to be emotional and behaviorally challenging, having difficult infant temperament. And all of this can occur because of the stress hormones that are being transmitted through your blood into the placenta of the fetus. So it's really important to keep those stress hormones, such as cortisol, at bay when you are pregnant. And when your stress hormones are high, well, that can affect you having a miscarriage. So we know that as a woman's stress level is high, so are the risk factors for miscarriages. And as you were saying, Karen, having the stress hormones can determine not just the health of the mother, however, also the health of the fetus. So along with that, a fetus can have developmental delay, um, uh, lower dopamine and serotonin levels, low birth weight. It could result in a preterm birth, developmental delays, as I've said. And what a lot of research also indicates is that when a woman's stress level is heightened, the fetus actually spends more time in deep sleep instead of quiet and active alert states. So it's almost like the majority of the fetus's experience is in deep sleep. And that can pose a problem during what some people call the fourth trimester. The fourth trimester is basically the first 3 months postpartum, when the infant hasn't acclimated to life outside of the womb. And therefore, because they have spent so much time in deep sleep, that their first 3 months experience outside of the womb is a huge stressor in itself. Um, so these are just some of the other effects of stress and anxiety, as you've said, preeclampsia, gestational diabetes, and your stress level is a huge factor during labor and delivery. How much pain and distress you're experiencing, complications, that can often lead to preterm labor as well as emergency C-sections. So what can we do about it to decrease the stress in our pregnancy? Well, first of all, it's important to be able to assess for what kind of stress and anxiety you're experiencing during pregnancy. So here are 7 questions that we here at the Renewed Freedom Center ask of our patients who are pregnant and dealing with anxiety. So what kind of worries and stresses do you have during the fertility treatment and pregnancy? What kind of anxious thoughts that are troubling for you to manage? Because the reality is that we all have anxious thoughts, and the anxious thoughts itself are not the problem. It's how you deal with the thoughts that's the problem. And if you aren't able to manage the thoughts, and if the thoughts repeat themselves, then that is something that we will need to pay more attention to and find solutions for. One of the most important factors in decreasing your stress level are your resources. What kind of resources do you have? Do you have a partner? Are you a single mother? Do you have a huge social support network? Finances, your socioeconomic status, those are all huge resources that can contribute to more or less stress. What methods are you currently using to de-stress? If you are trying to escape your stress through social media, well, that might not be the most conducive to being able to experience less stress. And what is the most important to you during pregnancy? What are the plans that you have for labor? I know a lot of women, they're not thinking about labor plans, especially during the first trimester. However, as you go through the second and when you arrive to your third trimester, it's important to think about what are the plans that you have for labor. Do you prefer a natural birth? Some women, especially if you're if you're in the high risk pregnancy category, having a natural birth may not be an option for you. And then what are some of the concerns you have postpartum? So answering these questions and having specific responses to these questions will help you, and if you're working with a clinician, will help the clinician in identifying solutions to some of these stressors that you have.
And I think one of the nice things about these questions is that it highlights that it's going to be really different for every single individual. Like, depending on their answers to those questions, then, the need for how to manage their stress or the anxiety is going to be very different.
Exactly, yes. So, the beautiful thing is that no two people will have the same birth plan. No two people will have the same concerns. There might be similar ones, however, they won't be the exact same concerns. And depending on what kind of concerns you have, then, then you can identify and develop a specific solution to those concerns that you have. So here are some ways for you to rebalance your mind and your body, because again, as what we have said from the very beginning, it's about being able to find balance. And I know that's a very overused word. However, when you are pregnant, that is truly important because, a lot of people talk about work-life balance, and I can tell you from my own personal experience, once your baby is born, there is no balance at all. So while you still can, try to find some balance between your thoughts, your behaviors, and your emotions. So the first thing is you want to be able to identify the thoughts and the behaviors that are problematic. And there are specific mental thought traps that can keep you stuck. I'm going to be going through some of them in a moment. And then also, when you're thinking about your situation, it's now time to change your thinking and reframing it from just me to me equals baby. So what does that mean? If I am thinking this is just for me, well, it's okay if I neglect my needs. It's okay if I don't prioritize self-care. However, if I'm thinking it's no longer just me, I mean, the body doesn't even belong to me anymore. It's me and baby, then I have to prioritize what's best for my baby. And if what's best is taking a 30-minute break, then that's what I have to do. So it's about changing your mind frame of from just me to me and baby. And, it's important to realize that you're now eating for two, not just eating for yourself. And when I say this, a lot of people then think, oh, that means I can just eat anything and everything. No, 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 that's not what I mean. Eating for two means if you think about whatever you're putting in your body, that is what your fetus is getting, then that might change the type of foods that you're putting in your body. So you want to be able to eat nutritiously because those are the nutrients that are going to go to baby. So that's what eating for two means. And then, of course, there's always that question of exercising. You know, some women who have been criticized for exercise until third trimester. And then there are some women who believe that, well, I can't be exercising because, that can put the baby at risk. The same person to be asking these questions is your OB, because your OB is the one who is assessing your health and baby. So if you're exercising, how much exercise you need to be getting, that's really a question for the internet, which comes to the next point. The internet is a friend of foe. Like, again, when it comes to the specific health related, really is the person to go to. When I have to hear these questions, we will get their OB on the phone and talk through what some of the concerns are. Now, the next important exercise is establishing healthy boundaries. And I would say this is important throughout your whole pregnancy as well as even after your pregnancy. And when we're talking about boundaries, we're not just talking about physical boundaries. We're talking about mental boundaries. We're talking about emotional boundaries. So if someone is giving you their advice, their opinions, that you really don't need in the moment, how can you establish those boundaries? I know that in my pregnancy, I had so many people telling me all of the dangers and risk factors of having twins and what I should and shouldn't be doing. I had to tell people I appreciated their comments, however, that I really didn't need that kind of information. And I think people can be understanding of that. And at the end of the day, if they're not understanding of it, oh, so be it. That isn't your problem. That's their problem. It's, again, very important for couples to unite during this period because, again, it is a journey for the both of you. It's not just, one person journey, of course, unless you're having this this pregnancy as a single parent. However, if you are in a relationship, it's really important to realize that this is a time to now clarify what your values are as a couple, what the roles are as a couple, identifying what some of the parenting goals and expectations are. I think too many times couples don't really clarify this before they get pregnant, and then once the baby is born, there are conflicting expectations and goals that can lead to later parenting issues down the road. And again, determining what your beliefs and your birth plans are, that is really important because that's going to help set the goal of how you want your experience to be. So as I said earlier, we're going to be talking about some thinking traps. So these are some very common thinking errors that we all experience. However, if you're able to identify them and realize them, then you can also be able to change them so they reflect reality more accurately. So uh, the first one is very common, all or nothing thinking, which is basically you take on one extreme or another in your thinking. So here's an example: if we don't pass all testing, the baby will be flawed. Well, that's not actually true. Just because you don't pass one test doesn't mean that that test is a all or nothing indicator of the baby's health. Some of these other ones, jumping to conclusion is very, very common, where you basically you can tell the future of what will actually happen, right? You assume that you know what is going to happen in the future, like you're looking through a crystal ball. So the example that I have here is my sister still couldn't conceive after 5 IVFs, so I'm pretty much doomed since I'm older. So that's jumping to conclusion. Then there's catastrophizing, which is huge during pregnancy, which is basically you think the worst case scenario. So you think, I failed my glucose screening test, so I must have gestational diabetes. That's also not true. There are many different types of glucose screening tests, and just because you failed one doesn't mean that you actually have gestational diabetes. And even if you do have gestational diabetes, it doesn't mean it's the end of the world. Some other thinking traps that are very common: discounting the positive, so you disregard any positive elements about yourself. So the example here is, it doesn't matter that we have healthy eggs and sperm, we'll still need to go through many fertility treatments like most people. And I think this is a common thought for a lot of people today, because unlike in the past when people would attempt pregnancy during their 20s, late 20s, a lot of people are waiting now. A lot of women are waiting now because of financial resources, because of their professions, and therefore a lot of women are not attempting pregnancy well into their 30s. And this is a fear that many people experience. Some other thinking traps: personalization and blame is very, very common during this period, which basically means you're holding yourself or other people personally accountable for things that might not be under their control. So here's an example: if I wasn't so lazy and had researched some more, then I would have avoided this doctor. I know one common fear that a lot of pregnant people have is that you want to find the perfect doctor. You want to research and research and research compulsively that the doctor that you have is the right one. So, you know, that is a fear that some people have. And then should statements are basically criticisms that you have for anything. And you use the word should, which it isn't productive, because it doesn't tell you, it doesn't give you a direction of what to do to be more productive. Instead, it's just criticizing. So you here, the example here is, I should have gone see the doctor sooner. Perhaps, but that still doesn't tell you what to do now. So what do you do with all of these mind traps? I didn't go through all of them for the sake of time. However, you can go back to the PowerPoint to get each of the different types of mind traps that exist. So you want to be able to first recognize the mind traps. So these are what we call automatic thoughts. And how do you recognize them? Well, anytime that you're feeling negative emotions, whether it's sadness, anxiety, anger, those are red flags for you that a thought probably just occurred. And the thought probably is filled with a lot of irrational traps. So you want to be able to use those negative emotions to identify what exactly the thought was. And then once you're able to identify the thought, then you want to inquire with yourself, is there any evidence to support this thought or this belief? And how would other people respond to this thought or belief if they had the thought? And it's funny because we always are more realistic with other people than we are with ourselves. So it's almost like we are our own worst critics, and therefore our bias towards ourselves tend to be more extensive than those for other people. So we're able to see that other people might not respond in that same way. That is a hint to us that, well, then perhaps our thoughts are there's not much evidence to support the reality of this thought. And if that is so, then what's an alternative thought to replace the one that you currently have? What's a more realistic belief, a realistic way of thinking about this situation? And at the end of the day, the idea is to tolerate and practice flexible thinking. So with all of these types of automatic thoughts, it keeps you thinking in black and white extremes. And to be able to entertain the possibilities of, it's like perspective taking, or there are always two sides to a coin, right? So it's your ability to practice flexible thinking of other possible explanations for this situation that you experience, rather than jumping to the thought and zooming in to that thought that you have. Some behavioral solutions, well, there is definitely mindfulness and relaxation training. Mindfulness training is huge. If you have specific labels that you're constantly giving yourself, or what I do with a lot of my patients is I ask them to really focus on those should statements that they have. Whenever they hear themselves say or think of the word should, that's a red flag that they just engaged in a mind trap. So you want to be wary of that. You want to give yourself plenty of time to engage in relaxing activities. One of the things that I did a lot of when I was pregnant was that I used a lot of focused visualizations. So to help me relax, I would actually visualize what my twins were doing inside my belly. And of course, as your belly gets bigger and bigger, you can feel them more and more, and that makes the visualization much more, much easier to engage in. However, when you are doing focused visualization, you're basically utilizing all 5 of your senses. You're using your visual imagery, your hearing, you're trying to hear your baby in your belly, you're trying to feel them. So as if you're using the focused visualization and imagining all of the beautiful things about your baby, then that will actually help you relax. Self-care equals baby care. When you care for yourself, you're caring for baby. Remember, me equals me plus baby. So you want to prioritize and schedule time for self-care. And these can be as simple as taking a warm bath, just reading about parenting, reading about how to care for a baby. So anything that you're doing that is relaxing for you, you want to be able to prioritize and schedule that. You want to engage in daily mental checks to make sure that your thoughts are rational and reflect reality. And if you're able to utilize those negative emotions as red flags for the thoughts, then at the end of the day, as you're collecting those thoughts, what I ask some women to do is to write down those thoughts that they have throughout the day. And then at the end of the day, go through that process of identifying the accuracy of the thought and coming up with an alternative thought to practice that mental flexibility. Detoxing digitally is really, really important. If you're spending way too many hours on the internet to look for information, that is at the expense of your self-care. So you want to be able to set aside time where the device is not near you. And it's important to be smiling and engaging in those feel-good sensations, because all of, there's so much research that shows that even when you're not feeling good, if you're able to smile and you're able to stand up straight with your head high and your shoulders back, you're actually producing positive hormones such as dopamine. And if you're producing those positive hormones, and those positive hormones are also being transmitted through your blood to your fetus. So it's important to decrease on the stress hormones and increase more of those positive hormones. Here are some tips and tools. We talked about a lot of this already. One of the things that I think is important is being able to keep busy with interesting, focused activities. So what some people do is, they go in for a test and then you have to wait a week or two for your test result. And then the person starts ruminating about the negative or the potential of the negative test results. So rather than just sitting there and ruminating, what I would suggest is pick up an activity to engage in and focus on. If you haven't sketched in a long time and this is what you enjoy doing, then do that. If you haven't played the piano for a long time and this is something that you've always wanted to get back to, then do that. However, whatever you do, instead of just doing nothing, which gives your mind this mental room to just, cycle into the worries, pick up a new skill or hobby.
Or instead of looking, in Google about all the possible.
Yes, do not do that. Do not go and research WebMD and all of those other websites about, well, what are the potential risks, of the test results. So at some point, you're going to also have to accept that you're not going to have the energy that you used to. As you go from the first and second to the third trimester, your energy level will deplete more and more. And therefore, it's important for you to allow yourself breaks. I know we are, in such a society where we expect so much of ourselves to be productive, yet maybe one of the most productive things that you can do for yourself and baby is to take a break, because that break will give you the energy to be recharged for more later. I know that when I was pregnant, I had my pregnancy brain where I was just so forgetful of everything. I remember when I was at ADAA in, I think it was Philadelphia at that time when I was pregnant, I had forgotten where my phone was and my phone was lost. And I remember another time I had left my water in the bathroom, but forgot that I left my water in the bathroom. So, you're going to have pregnancy brain, and then later as you become a mother, you're going to have mommy brain. And if you need to set reminders, you can set reminders on your phone, unless you lose your phone like I did, or you can use post-it notes at places where it'll be very visually visible to you. So we talked about using your negative emotions as red flags. We did talk about the ABC analysis earlier to identify stressors, so that the questions, those 7 questions in the earlier part of the presentation, those are of the specific stressor. So ABC basic stands for antecedent, behavior, and consequences. So if you can identify what are the antecedents, what are the triggers to your stressors, and then how do you respond to your stressors, and then what are the consequences to the behaviors of the stressors, then that can help you define a more realistic or a different approach to the stressor the next time around. One of the ways that I relaxed a lot, I would say throughout my whole entire pregnancy, was I listened to classical music. And classical music produces a lot of the alpha waves, the feels good waves. And that really helps to calm your mind down during periods when you aren't feeling so good, whether it's because of you're in your third trimester and you just physically aren't feeling good, or you're worried about, the upcoming birth of your baby. And then you can also use meditative type of music to calm your busy mind, and you can switch between the two. There are a lot of, Spotify, Pandora, Amazon Music. There's a lot of options for yoga, meditative type music, as well as classical music. We've been talking about boundaries. Boundaries are huge and important. You must be able to draw strict boundaries to other people's opinions, other people's suggestions and comments. And even if it means that you have to cut them off for a time period. There were some people in my life that I simply had to cut off during my pregnancy because they were just negative Nancy's, and they were just so negative about every little thing that I couldn't tolerate hearing any of that. So I literally had to cut some of those relationships, and I added, well, during this period in my life, I can't be hearing a lot of these comments. So if you can't resist informing me of these things, as even though it has good intentions, then perhaps we'll need to reconnect after I'm done with my pregnancy. There's also acupuncture that you can use to balance your hormones and energy, as well as minimizing aches and pains. So there's definitely alternative types of medicine. And when all else fails, then perhaps it's time to find an experienced therapist who works with pregnancy and anxiety and depression. Be compassionate to yourself. Be compassionate to your belly. Be compassionate to this unborn baby that's needing your nurturance. So being kind and compassionate, that means that you're creating a kind and compassionate environment for your fetus to grow and develop and evolve. I think one of the most important tool that I used was I just believed. I know that I don't want to say that belief is the same as having faith. Faith to me is kind of like blind, whereas belief, it's kind of like you're doing all of the things that you can possibly do to ensure that you have the best pregnancy for yourself and whatever feels right for you. And if you believe that you have done what you can, then you kind of just have to let go of that control, even though sometimes it's really hard, especially when you're pregnant, to let go of that control. The reality is you really don't have much control of everything else that's going to occur. So that also means being flexible and being able to go with the flow. Even if you have a plan, your birth plan, it doesn't necessarily mean that the birth plan will actually decrease, that the birth plan will actually go as planned. So it's about being flexible, going with the flow, giving up that control that in areas where you really don't have control over, doing what feels right for you, and then just believing in yourself and the positive of everything that you have been able to do. So I think those are some of just a quick run through of the tools and tips, and you can always go back to the PowerPoint to go through some of the tips and tools in more detail if I haven't had the time or the opportunity to go through them with you.
Well, thank you, Jenny. I think, we covered a lot for a 1-hour webinar. I think this is a topic that you can probably just focus on the prenatal aspects or the pregnancy aspect or the postpartum aspects. So hopefully maybe we can develop more webinars in the future that go more in detail. But yes, and I think we covered a great deal, and I think this will be very helpful for the public and the community. So thank you, Jenny.
You're welcome. Thank you so much for doing this today. This is a really important topic, and I hope the audience, get something from it.
Great. So thank you to everyone who joined us on this webinar, and look for the other webinars that we have from the public education community on a lot of other important topics that I'm sure would be very helpful to you.